Goat farming plays a crucial role in Kenya's agricultural landscape, providing a stable source of income and sustenance for countless families. It is a source of livelihood for many rural families who depend on goats for their daily needs and economic stability. Goats are hardy animals that can thrive in various climatic conditions, from the lush highlands to the arid lowlands. They provide meat, milk, and income for farmers, making them a versatile and valuable asset. In Kenya, goat farming is particularly important in arid and semi-arid regions, where other forms of agriculture may not be viable. These areas may not support other types of livestock farming, but goats can survive and even thrive, providing a crucial food source. The demand for goat products is high in Kenya and neighboring countries, driven by cultural preferences and nutritional needs. This makes goat farming a profitable venture for many farmers, who can sell goat meat, milk, and even live animals at local markets. Goats are also culturally significant in many Kenyan communities, playing a role in traditional ceremonies and rituals. They are often used in ceremonies and as gifts, symbolizing wealth, respect, and social status. The low initial investment required for goat farming makes it accessible to many farmers, including those with limited resources, enabling them to start small and gradually expand their herds. Goat farmers in Kenya face several challenges when it comes to disease management. One of the most prevalent diseases is pneumonia. It is caused by various bacteria and viruses. Pneumonia can spread quickly in goat herds, especially during cold and wet seasons. Symptoms include coughing, nasal discharge, and difficulty breathing. If left untreated, pneumonia can lead to significant losses in a herd. Another common ailment is foot rot. This bacterial infection affects the hooves of goats. It thrives in wet and muddy conditions. Foot rot causes lameness and can severely impact a goat's ability to graze. Regular hoof trimming and keeping the goat pen dry can help prevent foot rot. Antibiotics play a crucial role in treating bacterial infections in goats. One of the most commonly used antibiotics is oxytetracycline. It is effective against a wide range of bacterial infections. Oxytetracycline is particularly useful for treating pneumonia and foot rot. It comes in injectable form and is relatively affordable for farmers. Penicillin is another important antibiotic for goat health. It is effective against many gram-positive bacteria. Penicillin is often used to treat mastitis and other soft tissue infections. Florfenicol is a broad-spectrum antibiotic that is effective against resistant bacteria. It is particularly useful for treating respiratory infections in goats. Farmers should always consult with a veterinarian before administering antibiotics. Dewormers are essential medicines for controlling internal parasites in goats. One of the most widely used dewormers is albendazole. It is effective against a broad spectrum of worms, including roundworms and tapeworms. Albendazole comes in oral form and is easy to administer. Ivermectin is another crucial dewormer for goat farmers. It is effective against both internal and external parasites. Ivermectin can treat roundworms, lungworms, and some external parasites like mites. For more targeted parasite control, levamisole is an excellent choice. It is particularly effective against barber pole worms. Rotational use of different dewormers is important to prevent parasite resistance. Section 5. Vital vaccines for disease prevention. Vaccines play a pivotal role in maintaining the health and productivity of goat herds. Vaccination is a crucial aspect of preventive healthcare in goat farming. It helps in safeguarding the animals from various infectious diseases that can severely impact their health and the livelihood of farmers. One of the most important vaccines for goats in Kenya is the contagious caprine pleuropneumonia, or CCPP vaccine. This vaccine is essential in preventing a disease that can spread rapidly through herds. CCPP is a severe respiratory disease that can cause high mortality in goat herds. Without vaccination, an outbreak can lead to significant economic losses for farmers. Another essential vaccine is for peste des petits ruminants, or PPR. This vaccine is vital in protecting goats from a highly contagious and often deadly viral disease. PPR is a highly contagious viral disease that affects goats and sheep. Symptoms include fever, sores in the mouth, diarrhea, and pneumonia, which can lead to high mortality rates if not controlled. The foot and mouth disease, or FMD vaccine, is also important for goat farmers in Kenya. This vaccine helps in preventing a disease that, while more common in cattle, can still affect goats. Although goats are less susceptible to FMD than cattle, they can still contract and spread the disease. Vaccination helps in controlling outbreaks and protecting the health of the herd. Anthrax is another disease that can affect goats in certain regions of Kenya. Vaccination against anthrax is crucial in areas where the disease is known to occur, as it can be fatal to both animals and humans. Section 6. Proper administration of antibiotics. Proper administration of antibiotics is crucial for their effectiveness and to prevent antibiotic resistance. The first step is to accurately determine the weight of the goat. This ensures the correct dosage is given. When administering injectable antibiotics, proper injection technique is important. Intramuscular injections are typically given in the neck or thigh muscles. The injection site should be clean and dry. Use a new sterile needle for each injection. Always follow the manufacturer's instructions for storage and handling of antibiotics. It's crucial to complete the full course of antibiotics as prescribed. Section 7. Effective deworming techniques. Effective deworming is essential for maintaining goat health and productivity. Without proper deworming, goats can suffer from various health issues that can significantly reduce their growth and milk production. The first step in a good deworming program is to establish a regular schedule. This helps in keeping track of when each goat was last treated and ensures that no animal is missed. In areas with high parasite pressure, deworming may be needed every 3 to 4 months. This is because lush pastures can harbor a higher number of parasites, increasing the risk of infestation. In drier areas, twice a year may be sufficient. The lower humidity and sparse vegetation reduce the likelihood of parasite survival and transmission. When administering oral dewormers, proper technique is crucial. Incorrect administration can lead to underdosing or overdosing, both of which can be harmful to the goat. Use a drench gun or syringe to ensure accurate dosing. This equipment helps in delivering the right amount of medication directly into the goat's mouth. Place the tip of the drench gun over the goat's tongue towards the back of the mouth. This ensures that the dewormer is swallowed and not spit out. For pour-on dewormers, apply the medication along the goat's back, from the shoulders to the tail head. This method is effective for external parasites and is easier to administer in some cases. It's important to rotate between different classes of dewormers to prevent parasite resistance. Using the same dewormer repeatedly can lead to parasites developing resistance, making treatments less effective over time. Section 8. Vaccination schedules and methods. Developing an effective vaccination schedule is crucial for protecting goat herds from diseases. The schedule should be tailored to the specific disease risks in your area. Consult with a local veterinarian to determine the most appropriate vaccines and timing. When vaccinating goats, proper handling and storage of vaccines are essential. Most vaccines need to be kept refrigerated until use. Once a vial is opened, it should be used within a few hours. Always check the expiration date before using any vaccine. The method of vaccine administration varies depending on the specific vaccine. Section 9. Importance of proper medicine storage. Proper storage of medicines is crucial for maintaining their effectiveness and safety. Most medications should be stored in a cool, dry place away from direct sunlight. Many antibiotics and vaccines require refrigeration. Invest in a reliable refrigerator specifically for medicine storage. Regular power outages can be a challenge, so consider a backup power source. Organize medicines by type and expiration date. Place those expiring soonest at the front for easy access. Regularly check expiration dates and dispose of any expired medications properly. Never use expired medicines as they may be ineffective or even harmful. Keep all medicines in their original packaging with labels intact. Section 10. Recognizing signs of illness in goats. Early recognition of illness is crucial for effective treatment. Farmers should observe their goats daily for any signs of disease. One of the first signs of illness is often a change in behavior. A sick goat may separate itself from the herd or show reduced interest in feed. Physical signs of illness can include nasal discharge, coughing, or difficulty breathing. Diarrhea is another common sign of illness, often associated with parasitic infections or digestive issues. Monitor your goat's eating and rumination habits. A healthy goat should be eating and chewing cud regularly. Loss of appetite or reduced rumination can indicate various health issues. Section 11. Best practices for maintaining goat health. Maintaining goat health goes beyond just treating diseases when they occur. Prevention is key to a successful goat farming operation. One of the most important practices is maintaining good hygiene in the goat pen. Regular cleaning and disinfection help prevent the buildup of pathogens. Ensure proper drainage to keep the pen dry, especially during rainy seasons. Nutrition plays a crucial role in goat health. Provide a balanced diet that meets the nutritional needs of your goats at different life stages. Clean, fresh water should be available at all times. Good nutrition boosts the immune system and helps goats resist diseases.